Welcome to the Deep Dive. Today, we are immersing ourselves in quite a strategic plan. It's aiming for nothing less than a fundamental revolution in primary healthcare, specifically focused on a nationwide launch across India. We're dissecting the plan for Dr. Maya AI, which is, well, a unique symptom screening tool.
Yeah, and it's a remarkable project. It's not just about, plugging in some new tech. It's really a blueprint for a complete systemic and I'd say philosophical change.
Okay.
So our mission today is pretty robust. We need to analyze the source material we have, looking at the phased implementation, especially that crucial collaboration with medical schools in India. That's about training junior doctors.
Right, the junior doctor angle.
Exactly. Then we need to identify the gaps, the practical ones, financial, business gaps, things that need immediate attention.
Okay.
And finally, define a rigorous blueprint, for the proof of concept and then how to actually roll this out responsibly across the country.
That is certainly a massive undertaking. So the core goal of Dr. Maya, it's pitched as a shortcut to health knowledge, a symptom screening tool, helping junior doctors triage patients more effectively. But what really sets it apart, it seems, is this dual mission. First, identifying infected individuals for immediate isolation.
Which is huge for protecting healthcare workers.
Absolutely paramount, especially now. And second, this promise of truly universal accessible care, designed to cut across all literacy and socioeconomic levels.
Yeah, that's the really interesting part.
You're talking accessible health guidance for, well, everyone. Illiterate, literate, rich, poor.
And that universality, it's only possible because of the sort of philosophical framework behind it. What's fascinating here is the explicit attempt to transform healthcare.
From what to what?
From a system often driven by fear, anxiety, and, let's be honest, profit, into one based squarely on patient empowerment and, importantly, prevention.
And given the global threat of superbugs, antimicrobial resistance, and just spiraling costs, this isn't just a nice idea, is it?
No, it's presented as an economic and public health necessity. Okay, so let's unpack this shift. Why does the conventional system, the one Dr. Maya aims to replace, need such an overhaul? Where did it go wrong?
Well, the sources we looked at are pretty critical. They paint a picture of a system that kind of lost its way, especially highlighting the period between, say, 2011 and 2019.
Right.
That's where this modern model really started prioritizing, well, profit margins over actual healing outcomes or long-term patient well-being.
And that prioritization creates what the sources call the profit-driven trap. It imposes just an astonishing financial burden. I mean, escalating costs. And consider this, drug-related costs alone, over $11 billion daily. In the U.S.
That's $1 billion a day. That's hard to even grasp.
It's almost impossible to comprehend. And yet, look at effective preventive interventions. Things like simple nutritional guidance, exercise, lifestyle changes. These are consistently held to much higher, stricter cost-saving standards than the really expensive late-stage treatments and medications offered by that profit-driven model.
So the system itself discourages prevention because there's less money in it.
Pretty much. The entire financial structure of modern medicine inherently discourages prevention because, well, there's no clear way to profit from a patient who simply doesn't get sick.
And beyond the cost, there's this other problem you mentioned, dependency creation.
Yes, the insidious problem of dependency. The traditional doctor-centered pharmaceutical model. It conditions patients to believe health is external, something you get through continuous consultation, complex tests, taking pills.
Right. It's not something you cultivate yourself.
Exactly. It's designed to create long-term patient dependency. It diminishes confidence in the body's own ability to heal itself.
The sources are quite blunt about it, aren't they? Mentioning lasting changes in brain chemistry from drug dependence.
They are, noting that this kind of dependence produces significant and lasting changes in brain chemistry and function. It effectively traps patients in cycles of just managing symptoms, not getting to the root causes.
Okay, so that dependency cycle is dangerous on its own. But then you factor in infections and superbugs.
And it becomes catastrophically so. Let's connect this to the bigger picture. Antimicrobial resistance, AMR. You have to remember the sheer gravity of this. Deaths from antibiotic-resistant infections. They're projected to skyrocket. Maybe up to 10 million deaths a year by 2050.
10 million, wow.
The era where humans just dominated infections, what some sources call the kill, conquer, and rule era, that's essentially over.
And this looming crisis, you're saying it feeds directly into this fear cycle that Dr. Maya is trying to break.
Precisely. Think about it. A patient gets symptoms. First reaction, fear. Anxiety.
Yeah, you immediately think the worst.
Which leads straight to catastrophic thinking, oh no, this must be something terrible, and then you desperately seek validation, usually online or rushing to the ER.
Right, you want someone to tell you it's okay or what to do immediately.
Exactly. And this fear drives overreaction, unnecessary, expensive overtesting, and the demand for a quick fix, most detrimentally, antibiotics, even when they're totally inappropriate, like for a virus.
Which fuels AMR, but also harms the person directly.
Absolutely. It's personally destructive because It wipes out the patient's vital microbiome and that persistent stress-induced fear. It triggers the sympathetic nervous system, floods the body with cortisol, adrenaline.
The fight-or-flight response.
Right, which in turn severely compromises that gut-brain emotion axis we hear more about. It makes the body less capable of fighting off even minor infections naturally. So the profit model is, in a way, literally built on exploiting our emotions.
And this whole destructive cycle, it has immediate consequences for the project's partners, the healthcare workers themselves.
Yes, the need for tools like Dr. Maya is directly tied to protecting them. Healthcare workers, those coming into contact with seriously sick people, they are the most likely vectors to spread infections back into the community or get seriously ill themselves.
The sources mentioned a really chilling statistic about Ebola.
Yeah, over 50% of Ebola deaths were healthcare workers, tragically.
That's staggering.
And it paints a really disturbing picture for future pandemics. It's anticipated that in severe outbreaks, HCWs might even be treated as, well, untouchables, avoided socially, professionally because of their exposure.
Oh, wow.
So the strategy Dr. Maya enables early identification using the color codes, and crucially, isolation. It's critical. Not just for public health, but for protecting the doctors and nurses, making sure the whole system doesn't collapse under the strain.
Okay, so if the current system is stuck in this loop of fear, dependency, profit, how exactly does Dr. Maya propose to break that cycle? Let's get into its foundational philosophy and the actual mechanism.
Right. Well, the creator clearly understood the limitations of the existing medical mindset. They were apparently critical of doctors just relying on rote processes, checklists.
Especially for complex cases.
Exactly. That history is key. The creator was involved in acute and intensive care back in the 90s and was critical of just blindly applying protocols or pre-printed assessment sheets, especially for the critically ill. The realization was, you can't manage complex health situations by rote. Checklists fail when things get messy.
So the AI needed to be different, transparent, intuitive, educational even.
Precisely. And this brings us to a really crucial difference in the tech itself. We talk about Dr. Maya AI, but the sources emphasize it uses a GPT model, not just a standard algorithm. What's the significance there?
Okay, GPT versus standard AI. Why does that matter?
Well, a traditional static AI often uses opaque algorithms. So the decision-making is hidden. It's a black box. You don't know why it reached a conclusion.
Right.
Dr. Maya, though, uses a GPT model that's a generative pre-trained transformer. It's a large language model. This lets the system be conversational. It can adapt across different literacy levels, different languages even.
So it doesn't just spit out an answer.
No. It outputs an explanation, one that's culturally sensitive, easily understood, whether you're illiterate or a university professor. That's what enables that universal applicability they're aiming for.
And the output of this conversational model is that unique, transparent, color-coded system using symptom lists, combination patterns to differentiate serious from minor illness. So the user knows why.
Exactly. It's designed as a transparent triage system specifically to address and reduce that fear we talked about. Let's look closely at those three codes because the symptom combinations are key.
Okay, the code.
The red code. This signifies immediate serious action, triggered by classic critical symptoms, maybe a very high fever with extreme lethargy, sudden neurological changes, a rash that doesn't fade when pressed.
The really alarming stuff.
Right. The advice is direct. Speak to or consult a doctor immediately, or go straight to the hospital. Zero ambiguity.
Okay, red is urgent. What about blue?
The blue code is specifically linked to potential infections. This needs a more nuanced response. If you have multiple blue symptoms, say a moderate fever, a cough, persistent body aches, the advice is seek immediate professional help, but, crucially, isolate yourself right away to prevent spread.
So that's the infection control piece built right in.
Exactly. Now, if you only have one or two minor blue symptoms, the recommendation might be just a consult with a local doctor or nurse practitioner. It scales the response.
Got it. And then there's the green code.
The green code. This represents symptoms that can be safely managed locally, maybe with help from a chemist, a pharmacist, or a nurse in a triage setting. Minor things, seasonal allergies, a bit of stomach upset, muscle aches.
The everyday stuff.
Right. And this code is really the primary driver of empowerment. It gives the user permission, validation to handle minor issues without that psychological panic that currently swamps clinics and hospitals. It reinforces the idea your body can heal itself, give it a chance.
It's really striking because the goal isn't just clinical, it's emotional. Treating the fear first, especially when symptoms are minor, but the anxiety is high.
Absolutely. By giving logical, educational answers, it aims to stop that impulse towards defensive medicine. It avoids confusing medical jargon or those ambiguous predictions that just fuel more anxiety and lead to more tests.
And this approach you mentioned, it has deeper philosophical roots.
Yeah, the sources connect it to universal spiritual laws of balance. They emphasize that symptoms aren't just random failures, they're linked directly to that gut-brain emotion axis.
Right.
The system stresses self-empowerment, it recognizes the mind's huge role as a healer. The ultimate goal is conquering fear, which, as we establish, is directly linked to that destructive stress response.
And expanding on that holistic view, the sources say the app doesn't just stick to medical symptoms. It addresses personal and business dilemmas that cause fear. Why would a medical tool do that?
Because the goal is holistic health autonomy. The philosophy recognizes that chronic stress, whether it's from money worries, relationship problems, whatever, has a direct, measurable impact on your physical health.
How so?
It affects your gut microbes, inflammation levels, your overall ability to fight off disease. So if you can help someone manage the business dilemma causing constant stress, you're simultaneously reducing their physical vulnerability to illness.
Interesting. So it's addressing fear in all forms.
Exactly. Personal, business, medical. Dr. Maya tries to reinforce that emotional well-being and physical health are totally intertwined. It empowers the user to regain control over their whole life, their health choices.
Okay, so the philosophy and mechanism are clear. Let's shift to section 3. How does this powerful fear-disrupting tool actually get put into practice? Through the collaboration with medical schools, training junior doctors?
Right. And the foundation for this comes from proven methods. Its origins trace back to the pediatric assessment tool, PAT, developed way back in the 1980s.
For children?
Yes. It was designed specifically to help junior doctors who, have limited experience quickly tell the difference between typical benign childhood infections and the really severe, life-threatening ones.
High-stakes stuff.
Incredibly high-stakes medicine that allowed for timely hospital admission or safe discharge. The creators' 30 years in acute and intensive care really informed the rigor needed for Dr. Maya.
So the modern integration of Dr. Maya, the goal is to clinically ease the burden on these junior doctors.
Yes. By having the AI do that initial, transparent, color-coded screening, it quickly filters out the minor cases, highlights the genuinely severe ones. This should reduce unnecessary hospitalizations, save time, save resources.
And let the doctors focus on the complex cases. Offer better service overall.
That's the idea. Better patient service across the board.
And this operational efficiency ties directly back to that core mission of infection control.
Immediately. The rapid use of the blue code flagging potential infections, recommending immediate isolation that directly supports the collaborator's goal. Identify infected individuals before they spread illness in the hospital or community.
And isolation is fundamental to infection prevention programs. You mentioned the ROI on those.
Yes, and this is a crucial business point the sources highlight. These prevention programs consistently show an incredibly high return on investment, sometimes reaching 300% to 500% for hospitals.
3 to 500% ROI. Why is it that high? That's phenomenal.
It's a cascading effect financially. That ROI comes from drastically reduced hospital bed days, lower infection transmission rates among both patients and staff.
Right, protecting the workers too.
And maybe most importantly, avoiding the massive, often six-figure costs of treating just one patient who gets a multi-drug resistant healthcare-associated infection. Preventing that is exponentially cheaper and safer than treating it later, especially now with AMR.
Okay. The tool also seems to provide a layer of decision support for doctors facing that patient-driven fear, that demand for antibiotics. There was a fascinating clinical insight about fever.
Yes, this is where the medical science gets really interesting and actually informs the AI's design. The observation is that a very high body temperature often suggests a simple, self-limiting viral infection.
Okay, why is that?
Because most bacteria, which are biologically quite similar to us, struggle to survive at extreme heat, but their survival strategy is cunning.
How so?
Instead of just dying off, they release specific enzymes designed to paralyze the thermoregulatory center in the brain. This causes a sharp decrease in body temperature.
So the patient's temperature drops, they feel better.
Precisely, and that sudden temperature drop is a critical transition phase, but it's often mistaken by patients and sometimes even less experienced doctors as the start of recovery.
So they stop taking it seriously.
Right. They feel better, maybe stop taking medicine, less likely to come back for follow-up, but in reality, they might be entering the most dangerous phase, where the bacteria are really gaining a foothold. Septicemia could be imminent.
Wow. So Dr. Maya flags that specific pattern.
Yeah.
The high-low swing with other symptoms.
That's the goal, to ensure those high-risk cases are immediately re-engaged, not lost to follow-up because of a misleading temperature drop.
And you can see how this uncertainty creates huge risks for doctors. Fear of missing sepsis, fear of lawsuits.
Absolutely. Driven by fear of missing something critical or facing legal action, maybe professional harassment, doctors often default to prescribing broad-spectrum antibiotics, even when maybe not truly needed.
So the AI, by providing transparent evidence, shared guidance, it helps shift that dynamic.
It aims to. to help ensure the doctor-patient relationship is centered on trust, empowerment, objective tech, rather than being fueled by defensive medicine and mutual anxiety.
Shifting behavior on both sides, then. Patients stop demanding antibiotics out of fear.
And doctors avoid prescribing them just to avoid litigation or humiliation, which also protects the patient's microbiome. The only sustainable way forward is through shared knowledge, transparent tech empowerment.
That is a powerful vision. But, okay, making it real on a state or national scale in India, that needs immense business rigor, doesn't it? Let's move to section 4. Implementation gaps, validation, and the blueprint for scaling up. The mission's clear, but what critical business plan gaps need plugging?
Right. Philosophy alone won't cut it for rollout. The sources, especially those looking at healthcare capital project planning, point to 3 essential gaps that need detailed answers. We need data.
Okay, gap number 1.
First, a comprehensive market analysis and niche. You need solid data on the target geographic area. Demographics, current health status indicators, who are the existing competitors, hospitals, clinics, and what's the health center's intended market share? Where will patients come from?
You can't just assume need. You have to prove the market structure, prove the advantage of a tool reaching, say, illiterate populations or addressing business stress.
Exactly. You need proof of market demand. Where are the unserved people this AI will actually reach?
Second critical gap.
Financial projections and cash flow. The source material explicitly says Dr. Maya GPT can generate cash flow. Okay, prove it. That means detailed financial projections, consistent with past trends if possible, demonstrating viability and sustainability.
Breaking down the costs.
Precisely. Estimating all project expenses. They categorize them into hard costs and soft costs.
Hard costs being the tangible stuff.
Right. Servers, equipment for doctor kiosks, security infrastructure, any physical construction or renovation needed.
And soft costs. Often overlooked.
Often overlooked, but massive. Architectural design fees, legal counsel, especially for IP protection interest payments that accrue during construction before you're even operational.
Right, financing costs.
Fees for grant writing, business planning itself. You have to meticulously identify all sources and uses of funds, grants, loans, reserved cash, whatever it is.
And critically, especially in competitive areas like big Indian cities, the sources say these projections must be demand-driven.
Yes, based on actual anticipated demand and verifiable market forces. Not just hypothetically adding providers and assuming patients will magically show up.
Okay. And a third major gap.
Governance and strategic direction. The partners, the medical school, the developers, the operators, they have to clearly articulate the long-term strategy. Show exactly how this AI tool fits into the organization's overall mission statement, which rarely changes.
Demonstrating alignment, purpose, long-term commitment, not just a short pilot project.
Exactly. The strategy must align with the core mission.
Okay, that sets the business foundation. Now, validation. This is a complex GPT tool dealing directly with health. The proof of concept needs extremely high safety and ethical standards, right?
Yeah.
How do you ensure it's safe and effective?
Rigorous algorithmic and information ethics are non-negotiable. You need comprehensive validation. Evaluate the AI's accuracy, reliability, effectiveness, not just once, but continuously.
Compared to what?
Compared against established gold standard clinical guidelines and best practices. And critically, those specific to the Indian medical context. You can't just import standards. They have to be relevant. You have to monitor the tech constantly.
And ethically addressing bias is crucial, isn't it? Especially aiming for such a diverse population.
Absolutely essential. Bias detection and correction mechanisms must be built into the adaptive algorithm development. Think about it. If the AI mainly learns from data in a big city hospital,
it might miss things relevant to a rural farmer.
Exactly. It could develop a bias against recognizing symptoms presented differently by an illiterate rural farmer. The risk is profound. You have to actively work to ensure equitable empowerment across all populations. Fulfill that promise of helping the illiterate in the core avoid that one-size-fits-all trap AI can fall into.
And since the core goal is empowerment, conquering fear, taking charge, not creating a new subtle dependency. How do you measure that?
That's tricky. You need sophisticated empowerment metrics. Go beyond just clinical accuracy stats. Look at system usage analytics, error rates based on user demographics, long-term feedback. Does it actually lead to true patient self-management?
Or does it create tech reliance? Like people checking the app for every little thing.
Right. If the patient feels they must use the app for every hangnail, well, the system's failed its core purpose. It's created a subtle dependency, undermined self-judgment, and autonomy. You need metrics that actually gauge a reduction in collective health anxiety, not just successful triage.
And given the goal of using this for home-based care, managing minor infections at home.
then long-term follow-up studies are essential to ensure that strategy is safe over time.
How long do the benefits last? Are there unforeseen complications down the line?
Exactly. We need studies to determine the duration of benefits, identify any issues that only pop up after, say, a year or two of home management. That level of diligence ensures responsible long-term viability.
Okay, finally, let's touch on the practicalities of the collaboration itself, specifically with a medical school. The sources mention intellectual property, IP, is often a sticking point.
Oh, it's a classic conflict area. It absolutely must be sorted out with clear contracts up front. The standard industry position is pretty uncompromising. We pay for it, we own it.
Meaning the corporate partner funds it, so they own the IP.
Right, but when you partner with a university, the principal investigators, the PIs, they have academic rights that need protecting.
Such as, what are those necessary academic rights?
Primarily guaranteed publication rights. They need to be able to share the research findings openly. Also, a common compromise is allowing the PIs in the medical school to retain the right to use the IP internally for non-commercial research, teaching maybe for a set period like 5 or 7 years.
So academic work can continue.
Exactly. Ensures continued academic advancement and training. But this must be negotiated before the research even starts.
And tying it back to the business side, the deal should include clear due diligence milestones.
Absolutely. The medical school's technology transfer office will usually insist on this. These milestones need to be tightly linked to the business plan.
To ensure the tech doesn't just sit on a shelf after the study.
Precisely. The mandate is to move the AI from research to market quickly, ideally creating economic benefit, better healthcare access locally. This structured approach ensures Dr. Maya's revolutionary philosophy is built on a sound financial and ethical foundation. That's what allows for responsible scaling, state and national level.
This has been an incredibly detailed look. It's a healthcare innovation that seems as much about profound philosophical change as it is about sophisticated GPT technology. So to summarize, Dr. Maya GPT, it has this dual focus, right? Immediate measurable impact on infection, control of color codes, isolation protecting workers and the public.
Yeah, the practical, urgent piece.
And then the long-term systemic goal,
Yeah.
transforming that fearful dependency-based healthcare paradigm.
Right, into one of empowerment. And the sources really hammer this home. The single emotion a person must conquer, the one tied so strongly to stress and poor outcomes, is fear.
And Dr. Maya is explicitly positioned as a tool to help conquer that fear.
As a technological aid, yes. Helping individuals regain their free will, their autonomy over health choices. So, if the ultimate test is patient empowerment, maybe the true measure of this technology isn't just traditional clinical stats like mortality rates.
Well then,
Perhaps it lies in the measurable reduction of collective health anxiety, that pervasive societal level of fear that currently drives so much over-medicalization. If Dr. Maya can actually shift that, well, that truly defines a revolution in consciousness, doesn't it?